वेलकम टू जी मनी हेल्थ शो। मैं हूं नेहा बजाज और अपने हर शो में हम आपको मिलवाते हैं मेडिकल एक्सपर्ट्स और सुपर स्पेशलिस्ट से। और इस वीडियो को आगे देखने से पहले जी मनी के यूट्यूब पेज को लाइक, शेयर और सब्सक्राइब करना बिल्कुल ना भूलें। और आज के वीडियो में हमारे साथ जुड़ रहे हैं डॉक्टर रोहित प्रसाद, जो कि एक फैमिली फिजिशियन है, डायरेक्टर है सरजू नर्सिंग होम नागपुर रांची से। तो उनका स्वागत करते हैं आज हमारे शो में। डॉक्टर प्रसाद, आपका बहुत बहुत स्वागत है।
Thanks a lot, Neha.
एंड डॉक्टर प्रसाद, आज हम एक ऐसे विषय पर बात करने वाले हैं जिसको बहुत सारी महिलाएं फेस करती हैं, बहुत सारी मिडिल एज्ड वुमेन फेस करती हैं और उसके बाद बड़ी दिक्कतें भी होती हैं। उस बीमारी का नाम है थायराइड, जो इनफैक्ट मेरी मदर को भी है और कहीं ना कहीं उसकी दवाई जो है वो लाइफ लॉन्ग ही बन जाती है। तो सबसे पहले हमारे व्यूअर्स को आप ये बताइए, थायराइड क्या होता है?
Okay, very good afternoon, everyone. First of all, I would just let you know that basically thyroid is a small butterfly-shaped gland. It has two lobes and that is connected by isthmus, and it is positioned just in front of the neck, just below the Adam's apple. So its main functions are it produces very important thyroid hormones called thyroxine. Now, what is the function of thyroxine? We have to understand that thyroxine basically helps to regulate the body functions and body metabolism, and it also helps in regulating the heartbeats. So if we are not having a proper thyroxine production, then we may develop certain diseases from thyroid glands, that is maybe hyperthyroidism, hypothyroidism, depending upon the TSH level.
ओके एंड सर, ऐसा क्यों होता है कि लेडीज या लड़कियों में ही थायराइड की दिक्कत ज्यादा देखी जाती है?
Basically 80% of the women are suffering from thyroid, either hyperthyroidism or hypothyroidism. That is because the male structure, human body is having the more capacity to escalate the body metabolism as compared to women. Now it might include the intake of like calcium supplements, multivitamins, magnesium supplements. So basically it's genetic and it's biological that due to these reasons women are more prone to develop thyroidism rather than.
एंड सर, एक और चीज, अगेन थायराइड अक्सर देखा जाता है कि आजकल तो यंग लड़कियों को भी हो रहा है, बट क्या वो गिने चुने कारण हैं जिस वजह से थायराइड बढ़ता जा रहा है?
थायराइड बेसिकली क्या होता है कि आज in today's trend what is happening that young generations are not having a proper diet, and iodine is a very major component of diet which controls the production of the thyroxine hormone. And apart from that, as I already mentioned, that the young generations are more inclined towards fast food, and the diets are not, we usually just prescribe our patients or prescribe a normal family to have a routine balanced diet. So just because of that, there's a lack of multivitamins, especially vitamin B12, which plays a very important role in hypothyroidism. So that basically escalates the production of TSH, which prevents. So we can just compile it to just because of the lack of a proper diet and proper exercise.
ओके एंड सर, जब बेसिकली फॉर एग्जांपल आई एम अ यंग वुमन और अभी मैंने टेस्ट नहीं कराया है, तो मैं अपने अंदर क्या वो साइंस एंड सिम्टम्स देखूं जिस वजह से मुझे लगे कि दिस कुड बी द स्टार्टिंग ऑफ थायराइड?
It just depends if a male can develop separate symptoms rather than female. If a male can develop, he might have hair loss, he might have gynecomastia. Gynecomastia is basically the male breast enlargement. Yes, then he might have loss of body muscle mass, which is very much common in both male and female. Then erectile dysfunction. There are many other symptoms that you must go for a test for thyroid, basically TSH test.
And what about females, or as a female, what are the red flags that we should look for कि ये तो thyroid की starting है?
कि thyroid की starting के लिए basically जो what are the it depends upon whether you are developing. We can't say that it is thyroid. We have to just first filter it whether it's hyperthyroidism or it's hypothyroidism.
अच्छा.
Because thyroid is just merely a gland, and the disease is hyperthyroidism or hypothyroidism, right? So in female it's basically the hair loss which just defines the initiation of the thyroid that you are having developed.
गेन होता है because अक्सर ऐसा देखा जाता है कि थायराइड के बाद लेडीज को वेट गेन हो जाता है.
It depends upon whether the age of the woman, like pregnant women are more prone to gain weight during thyroid. It's not about being any age group of female.
Also sir, जैसे कि आपने हमें एक जवाब में बताया कि men are also prone to thyroid, तो उनका treatment versus a woman's treatment is different, and is thyroid permanently curable?
It just depends upon the severity of the thyroid, whether it's permanently, it can be like final treatment is the thyroidectomy, that is the completely removal of the thyroid gland. But prior to that, if a person is having hyperthyroidism, then usually just we prescribe the patient to have this beta blocker and depazole, and like also anti-thyroid drugs like methamanazole, so that we can just lower down the thyroxine production, which is very much similar for the male patients also and female patients also. In case of if the patient is having hypothyroidism, that is the production of the thyroxine level is less, then we can just prescribe that patient to have a levo-T drug, and which is again common in both male and female.
Okay.
And also parallel to that, just to increase the absorption of these drugs, we also prescribe to have like calcium supplements, magnesium, iron supplements, and multivitamins and vitamin B12.
Also sir, how do we cure thyroid symptoms, और thyroid का treatment और किस तरीके से हो सकता है? क्या कोई home remedies भी हैं? क्या lifestyle changes से भी control में रह सकता है?
Definitely, home remedy is the first step, which will definitely help us to subside the thyroid and even help us to have the less possibility to develop thyroid. Like coconut oil is very much helpful.
Coconut oil खाने के लिए आप बोल रहे हैं?
That is non-heated coconut oil. It's not coconut. It's coconut oil. Non-heated coconut oil. You can have ginger tea. Ginger is very good. Ginger tea. Vitamin.
कोकोनट ऑयल आप कह रहे हैं कि वो खाने के खाना बनाने में कोकोनट ऑयल का इस्तेमाल होना चाहिए?
नहीं, खाना बनाने में कोकोनट ऑयल इज अ सेपरेट, वो अलग से मिलता है कोकोनट ऑयल. खाना बनाने में जो कोकोनट ऑयल यूज होता है, दैट इज द हीटेड कोकोनट ऑयल, बिकॉज वी नीड टू just heat it up and then add whatever
आपने जो कोकोनट ऑयल बताया, मतलब उसका कैसे?
that will taste separately. वो अपने को सेपरेटली मिलता है कोकोनट ऑयल.
ओके, तो उसको क्या मतलब मसाज करना है?
नहीं, we have to just intake of coconut oil. Yes, it's edible coconut oil. Edible coconut oil. Very much available in the market. Yeah, it's available in the market, and we should intake it without heating it up. Just direct intake of. Like if we are having ginger, then we can have sliced ginger, just topped up with the vegetables, and we can have ginger tea early morning. That is very good to even subside the thyroid, and even to just keep you less prone to develop thyroid.
Achha.
And also have multivitamin tablets, it's very common, A to Z. I think every layman is knowing these days A to Z tablet, and vitamin B12 is very much helpful. These are the home remedies, like you can help to mitigate the thyroid possibility.
Okay, and my last question to you sir is because क्या है कि हमारे देश में जब तक कोई चीज बहुत बड़ी नहीं हो जाती, हम डॉक्टर को नहीं दिखाते, टेस्ट नहीं कराते. तो आप व्यूअर्स को कुछ कहना चाहेंगे कि भाई अगर आप अपने अंदर ये चेंजेस महसूस कर रहे हैं तो एक बार डॉक्टरी जांच जरूर करवाएं.
Definitely, what is happening, like we witnessed this in very much during the COVID, and what happened that during the time, I'll just take 5 minutes if it won't happen much, then during the time of COVID, what happened that everyone was very much willing to treat themselves on their own, right? We witnessed them during last 2 years only. But what happened? Suppose I'm just giving you an example. If a person is having he's very much into gymnastic. Okay. Now, what the gym trainers advise them to have protein shakes.
Yeah.
Correct. This is very common, but what the clients do, what the common man do, he just follows the advice of the gym trainer and just administers protein irrespective of whether acknowledging that he's, what is the quantity of protein what is the amount of protein he's already having in his body, because surplus of protein also results in proteinuria, and this is very common in the person who's doing heavy exercise in gym, that he develops a mass or like bulge kind of in the skin just because of the excess of protein. So basically, prior to making any change to your body, you should definitely go and consult a doctor. And during the COVID times also, everyone was having multivitamin, everyone started during COVID, everyone was having iron tablets, everyone was having multivitamins, and there was a, like, what happens ki everyone was having for cup syrup, everyone was having cup syrup. But if a patient is diabetic, then he should be prescribed a proper non-sugar cup syrup rather than for general cup syrup. And what happened that there are many cases that patients started having normal cup syrup even being diabetic, just because of lack of acknowledgement, and then sugar level boosted. And when sugar is very mandate part that it controls immunity. So what happened ki they had an increase in sugar level, and that invited much of comorbidities along with. So I would definitely suggest everyone that prior to start any medication or like home remedies are only suggested on advice of personal doctor.
एब्सोल्युटली। और आपने बड़े अच्छे एग्जाम्पल से भी बोला कि खुद के डॉक्टर नहीं बनना है, डॉक्टरों को कंसल्ट करना है, और यही जी मनी हेल्थ शो का पर्पस है। थैंक यू सो मच डॉक्टर रोहित प्रसाद, आप जी मनी हेल्थ शो से जुड़े, आपने अपना कीमती वक्त निकाला और इतनी अच्छी इंफॉर्मेशन आपने सबसे शेयर।
थैंक यू, थैंक्स अ लॉट मिया, थैंक यू, थैंक्स अ लॉट।
तो ये थे डॉक्टर रोहित प्रसाद, जिन्होंने हमें बताया थायराइड के बारे में, और विमेन को ज्यादा होता है, टेस्ट होते हैं, अपने लाइफस्टाइल में हम चेंजेस लाकर इसे जरूर कंट्रोल कर सकते हैं। एंड यस, थायराइड एक बड़ा रूप ले सकता है, बिकॉज मैं भी जानती हूँ कि थायराइड के बाद हाँ वेट गेन होता है, हेयर लॉस होता है, कहीं ना कहीं हमारी पर्सनालिटी में भी चेंजेस आते हैं। सो आई एम श्योर आज का वीडियो आपको पसंद आया होगा। अगर आप किसी और विषय पर भी चर्चा देखना चाहते हैं तो कमेंट बॉक्स में पोस्ट करके हमें जरूर बताएं, या फिर इंस्टाग्राम पर आप हमें डीएम भी कर सकते हैं। तो इसी के साथ मैं नेहा बजाज आपसे लेती हूँ इजाजत, मिलूंगी आपसे जी मनी हेल्थ शो के एक नए वीडियो में नए सुपर स्पेशलिस्ट के साथ। टिल देन स्वस्थ रहिए, मस्त रहिए, अपनी सेहत का ख्याल रखिए। बाय।